30 kilometers outside the Siberian city of Tomsk, every day, twice a day, a nurse makes the journey to find patients with tuberculosis. The first on the list, 59-year-old Nadezhda, is being treated for a virulent form of the disease, MDR, multi-drug-resistant TB. It doesn't respond to the two most common tuberculosis drugs. Instead, it will take 20 months, 20 pills a day, and injections to cure it. How are you feeling? Nadezhda told us her legs were hurting and she had high blood pressure. Where had she contracted the disease? She said she used to be a nurse in a TB hospital. 300 Russians a day are now being diagnosed with tuberculosis, and those are only the ones who are found. The figures are likely to be far higher. Then it was on to the next patient, another half-hour drive away on the dirt road. 39-year-old Zemfera, who's had to endure not just the treatment, but the social stigma this disease carries with it.
И наговорили открытая форма туберкулеза, то, что всех заражаю. Как бы и ребенку запрещали разговор с соседями.
Tuberculosis is a bacteria spread by coughing, sneezing or spitting. It's debilitating and it can kill. The rates of the most common form are falling in Russia, but MDR and XDR, that stands for extensively drug resistant, are on the rise. The country now has the highest levels in Europe and the third highest in the world. This is an epidemic, often driven by poverty, alcohol, drugs, and increasingly HIV.
На 60% это экономически и социально дезадаптированные люди, это люди, не работающие из малообеспеченных семей. До 60% наших пациентов из всех это алкоголезависимые люди, до 25% это лица, страдающие наркоманной зависимостью.
So in Tomsk, they've been conducting an experiment, throwing millions of dollars of international aid money at the problem. They call it the Sputnik program, after the famous Russian satellite. They circle the streets and villages looking for TB patients who are refusing their treatment. And they lure them into clinics and give food parcels, tinned beef, vegetables and jam as an incentive to take their pills. The rates of TB in Tomsk are now half the national average. We get given the medicines and these rations every day, she told us. It helps a lot to get something to eat. And again, with the help of that international funding, the Tomsk project includes its local prison. What's fueling the epidemic in Russia is its prisons. In fact, one recent report says they have the highest rates of antibiotic-resistant TB in the world. So here in Tomsk, this is how they've dealt with it. All prisoners from around the region with TB are put into that building. It is effectively a TB prison. Of the 700 inmates when we arrived, 500 of them have TB or have been successfully treated.
Ведь если мы его не вылечим, он же выйдет в общество рано или поздно и заразит массу людей. Он заразит детей, он заразит, всех вокруг. И тогда будет все больше и больше больных туберкулезом, будет множиться в популяции вот это бациллярное ядро, будут болеть и умирать люди, будут болеть и умирать дети.
Attention, the sign says. Tuberculosis, heightened danger zone. We weren't allowed to go further, but behind the windows we could see the prisoners with MDR who are still contagious. They're confined here for months on end. They're proud of their facilities. They're certainly better than in most Russian prisons. The problem, of course, is that there are forms of this TB that are so contagious we can't go in without being completely covered. MDR and XDR are on the rise. They showed us the figures collected in the laboratories, high-tech by Russian standards, with equipment donated from abroad. Detecting the strain of TB is crucial, so prisoners can be started on the correct medication immediately. And even when they are allowed out of the locked wards and back into the open part of the prison, they still have to take their drugs under the watchful eye of a nurse. We were introduced to Ivan, a 28-year-old who's being treated for MDR TB. He almost certainly contracted it in the first prison he was sent to, so he was moved here. How do you know that you didn't have it before you went to prison?
При поступлении в учреждение сдаются анализы, то есть мне сказали, что я здоров. И по истечении 3 лет, то есть я заразился в течение этих 3 лет, пока отбывал наказание в той колонии.
The hope was always that this TOMS model would be rolled out across Russia. But now the federal government has taken a decision that has astounded international observers. It's kicked out USAID, the largest funder of TB programs, including the TOMS project, and it's refused help from the Global Fund. It says it will now pay for Tomsk, but dozens of other TB programs have closed. Why do you think the USAID funding was stopped?
You mean for Russia? Because of political reasons. I think that USAID, they provided financial support for many political organizations, NGOs, and for mass media. I think that is the main reason.
And that was what we found as we travelled through Siberia. In March, a USAID-funded program for TB was closed in the city of Omsk. It had cared for nearly 300 patients, more than 10% of them with MDR. Nothing has replaced it.
Очень было грустно от того, что вот эти вещи, которые происходили на уровне страны, различные политические, конкретные люди из-за этого оказались без той помощи, которую они могли бы получать еще 2 года.
In this grim local hospital, they took us to see Valentina, who was being treated for a broken leg that won't heal, partly because of the TB.
Ничего такой компенсации нам государство не выдавало. Помогало в том, что вот люди еще идут за лекарствами, вот. Им подаются за это продукты, вот они идут за лекарствами. У них как бы для этого был какой-то стимул.
The Russian government insists it's capable of funding TB programs. It says it doesn't need international money because it's now a donor itself. But few are convinced. HIV funds regularly go missing, and TB drugs have failed to materialize in the past.
USAID, that was a powerful bilateral support to TB programs, is no more present in Russia. And at the same time, the change in the system from the sort of immediate post-Soviet TB system to a modern TB system is occurring at an extremely slow pace.
And yet there is a new urgency. TB rates, including MDR, are rising amongst children.
If anything serves to underline the size and the seriousness of the problem in Russia, it's encapsulated here in this building, a 400-bed TB hospital in the suburbs of Moscow. It's almost always full, and a quarter of the patients being admitted are children.
What's more, they are in increasing numbers being admitted with drug-resistant TB. Their treatment can last for months, and it's harsh, but there is no choice.
Поскольку проблемы МДР туберкулеза в России есть, поэтому дети чаще всего заражаются уже устойчивыми формами с МДР и с XDR.
How difficult is it to treat children?
Трудно поддается лечению, если это лекарственно-устойчивая форма. И у детей трудности еще в том, что они еще более тяжело переносят токсичные препараты, чем взрослые. И многие препараты и вообще не рекомендуется давать в детском возрасте.
20,000 Russians a year die from TB, but tuberculosis is not kept within the confines of hospitals or prisons or contained by borders, which means it's not just a problem for Russia. Its destination could be anywhere else in the world.